Chapter 3 Body Tissues. Body tissues cells are specialized for particular functions. Tissues, groups of cells with similar structure and function. 4 primary types: epithelium, connective tissue, nervous tissue, muscle. Epithelial tissues: locations, functions, characteristics, body coverings. Body linings, glandular tissue. Functions: protection, absorption, filtration, secretion. Characteristics: cells close together. Cells have free apical surface. Bottom surface is basement membrane. Avascular, no blood supply. Regenerate easily. Classification of epithelium. 1. Based on hash of cell layers. Simple, 1 layer. Stratified, more than 1 layer. 2. Shape of cells. Squamous, flattened. Cuboidal, cube-shaped. Columnar, column-like. Simple epithelium. 1. Simple squamous single layer of flat cells. Usually forms membranes. Lines body cavities. Lines lungs and capillaries. 2. Simple cuboidal single layer of cube-like cells. Common in glands and their ducts. Forms walls of kidney tubules. Covers the ovaries. 3. Simple columnar single layer of tall cells. Often includes goblet cells, which produce mucus. Lines digestive tract. 4. Pseudostratified. Single layer, but some cells are shorter than others. Often looks like a double cell layer. Sometimes ciliated, such as in the respiratory tract. May function in absorption or secretion. Stratified epithelium. 1. Stratified squamous. Cells at the free edge are flattened. Found as a protective covering where friction is common. Locations: skin, mouth, esophagus. Rare in human body. 2. Stratified cuboidal. 3. Stratified columnar. 2 layers of cuboidal cells. 3. Stratified columnar. Surfaced cells are columnar, cells underneath vary in size and shape. Both are found mainly in ducts of large glands. Gland, 1 or more cells that secretes a particular product. 2 types. 1. Endocrine gland. Ductless. Secretes hormones. 2. Exocrine gland. Empty through ducts to surface. Includes sweat and oil glands. 4. Transitional epithelium. Shape of cells depends upon the amount of stretching. Lines organs of the urinary system. Connective tissue most abundant and widely distributed. Some have good blood supply, vascularized. Some don't, avascular. All have extracellular matrix, non-living material surrounding cells. Functions: binds tissues together. Supports. Protects. Extracellular matrix 2 parts. Ground substance, mostly water along with adhesion proteins and polysaccharide molecules. Fibers. Produced by the cells. 3 types. Collagen fibers. Elastic fibers. Reticular fibers. Connective tissue types. 1. Bone, osseous tissue. Bone cells in lacunae, cavities. Hard matrix of calcium salts. A lot of collagen fibers. Protect and supports body. Connective tissue types. 2. Hyaline cartilage. Most common cartilage. Lots of collagen fibers. Rubbery matrix. Fetal skeleton and ribs. Connective tissue types. 3. Elastic cartilage. Provides elasticity. Found in external ear, epiglottis, and trachea. Connective tissue types. 4. Fibrocartilage. Highly compressible. Forms cushion-like discs between vertebrae. Connective tissue types. 5. Dense. Main matrix element is collagen fibers. Cells are fibroblasts. Tendon dash. Muscle to bone. Ligaments dash. Bone to bone. Connective tissue types. 6. Areolar. Most widely distributed. Soft, pliable tissue. Contains all fiber types. Can soak up excess fluid. Think airy. Connective tissue types. 7. Adipose. Similar to areolar with fat globules. Many cells contain large lipid deposits. Functions. Insulates body. Protects organs. Fuel storage. Connective tissue types. 8. Reticular. Delicate network of fibers. Forms network of lymphoid organs. Lymph nodes. Spleen. Bone marrow. Connective tissue types. 9. Blood. Cells and fluid matrix. Fibers visible during clotting. Transports materials. Muscle tissue function equals produce movement 3 types skeletal muscle. Move muscles of skeleton. Cardiac muscle. Only found in heart. Smooth muscle. Found in organs and vessels. Muscle type. Type of control. Striations. How many nuclei? Skeletal. Voluntary. Yes. Many per cell. Cardiac. Involuntary. Yes, and intercalated discs. 1 per cell. Smooth. No.